Welcome back to Youth in Politics. Now we're going to turn to Hillary Clinton's proposed health care plan. Henry, do you want to sort of explain what she's been proposing here?
Well, I'm very excited about her plan. I'm very impressed with it. I think most Americans, especially ones without health insurance, are glad to see there's finally some action taking place. What simply she requires every American have health insurance. She expands the successful CHIP program for low-income children. Essentially, you're insured no matter if you're working or not, no matter if you switch jobs or not. She lowers the standard for federal assistance in subsidizing private health plans. She allows for choice, but at the end of the day allows for comprehensive coverage as well. It's a great program. I'm very excited to talk about it.
So what would you guys say in response to this sort of plan?
Well, it was not what I expected. I expected a more universal plan. I expected a top-down government plan. It's similar to Romney's, a little bit different, but basically it doesn't address any of the problems with healthcare, which is the cost. It addresses the cost of healthcare in no way at all. The cost of health, and the reason for that is she doesn't know why healthcare costs are as high as they are, as most Americans don't, and most supposed experts don't know why healthcare is as expensive as it is. The major reason healthcare is as expensive as it is for three reasons. Regulations. Every year, there's $169 billion in costs added on to imposed on the healthcare industry because of onerous regulations. $169 billion, all right? So that translates into higher costs. Then you have the fact that you have a third-party payer system, which disconnects consumers from the products that they're consuming. So what you end up having is consumers consume more of the product because you're not facing any constraints. And so that's dealing with the employer-based system. And so that results in higher demand, results in higher prices. And then the third thing is Medicare. Medicare is one of the primary reasons why healthcare costs are as high as they are in this country, because you are providing a free service for people, and so they end up using it more than they would otherwise. 2 years after Medicare was passed in this country, the Medicare legislation was passed in this country, healthcare costs doubled. There's a direct relationship between the size of the Medicare system and the cost of healthcare. Once you get rid of these things, you'll see healthcare costs plummet, and therefore people will be able to afford them. I don't think a socialist approach is necessary. I think we need a free market approach.
Well, people pay into the Medicare system as they earn wages, throughout their lifetime.
They're still disconnected from the prices.
It is true that covering everybody with quality coverage is expensive. And we have a responsibility to cover those who can't do it themselves, to take care of the sick and the uninsured. It won't be easy. It might be expensive, but that's the nature of government.
Why don't you just address any of the points that I just made about the regulations and the third-party payer system and Medicare? Why don't you just address any of those points?
I think you want to look.
You're evading the issue. You're evading the issue, Henry.
Let's let them
Jacob, calm down. You've been talking for a while. Now, if you look at what's really going on here, is you look at people like Hillary, people like John Edwards, even Barack Obama, to a certain extent, are proposing plans that are trying to fix healthcare. They're trying to do something new.
Because they don't know the problem.
They're trying to cover people. The majority of the American people want a universal healthcare system, want the uninsured to be insured, and if you look at the plans that the Republicans are proposing, it's all the same. It's the old system, it's the broken system, the private healthcare with the high
we had a more free market system.
Let me tell you something. Let me tell you something. The polls that keep saying that all Americans want healthcare, the 65% want healthcare, if you add in at the end that it's going to cost $150 billion to do, the results will completely flip. So these statistics are being used by healthcare advocates to their advantage when they're not really saying that. And let me say something else. All of these plans that have been proposed advocate for more government involvement in the process. And as the people of Maine who are watching this program know, Dirigo has done the exact same thing, and it's resulted in higher premiums, not very many people enrolling, less competition, and more regulation. And when you have less competition, you have higher premiums.
Ralph, this is a private. This allows for private companies to still offer their services. This is not a government.
You don't agree that there's more government involvement than prior?
I think that the government is making sure that all people are insured, but it's still a private plan.
I want that too, but you have to do it in a rational way.
There's something to be said that we're the only westernized country right now that doesn't have a universal healthcare system.
Yeah, there's something to be said that we've actually wisened up to the idea that socialism doesn't work. Yes, I think there is something to be said in that regard. For 2 points. One, no one addresses the fact that the reason healthcare costs are as high as they are is because of the 3 reasons I presented. No one addresses that. You're evading the issue, Henry. And then the second thing is, by what constitutional right does Hillary have to mandate that I get healthcare? If I don't want to get it, is she going to lock me up for it?
Unfortunately, everyone, we have to wrap up once again in the middle of this very heated discussion. Tune in next week for another edition of Youth in Politics. Thanks.